Gestational diabetes, or diabetes during pregnancy, is when you develop diabetes during pregnancy and you didn't have it prior to pregnancy. In most cases, it usually resolves after the baby is born. It's usually diagnosed when high glucose levels during pregnancy is detected. I'm going to go through everything you need to know, including all necessary tips, and my name is Dr. Anne. If I can ask you for a big favour, if you can click subscribe, it helps me to keep producing more videos. What causes gestational diabetes? Gestational diabetes is when your body is not managing to produce enough insulin to keep up with the body's requirements during pregnancy. Insulin is what allows glucose to travel from the outside into your cells, where it can be converted and used as energy. Around 5 to 7% of women develop gestational diabetes during pregnancy. So why is it hard for your body to keep up with all the insulin requirements during a pregnancy? Insulin is a hormone produced by your pancreas, and it helps regulate glucose levels. What it allows is for the glucose to move from the outside in your blood into the cell, where it can be used for energy and storage. All of your body's cells need glucose to function. Gestational diabetes is a form of diabetes that develops during pregnancy and was not there before. It usually resolves after the baby is born. What are the possible risk factors to lead with gestational diabetes? Some risk factors include being overweight, having a family history of type 2 diabetes, having a previously large baby, having had gestational diabetes in your last pregnancy, being over the age of 25, being from certain ethnic backgrounds like South Asian or Chinese, Middle Eastern, Mediterranean. These are all potential risk factors. What are the complications of having gestational diabetes during pregnancy? Well, I want to start by reassuring you. If you have gestational diabetes and your diabetes is well controlled with diet, with exercise, then the risks are generally very low for you and your baby. If you have uncontrolled diabetes or you end up needing medications like insulin, the risks are higher. If you go on to develop diabetes or need medications during pregnancy, this is not because you did something wrong. Sometimes you can follow all the necessary advice, but due to the changes in your body, the new hormones being produced, there can be lots of different factors at play leading to your development of diabetes. Often in clinic, I will see women feeling guilty or feeling demoralized because they've developed diabetes. Lots of changes happen throughout your body during pregnancy, and there is no blame involved. We're just here to support you. What are the possible health complications for you and your baby of having gestational diabetes? If you have gestational diabetes, the impact on the baby could lead to conditions like large baby, 9 pounds or more, and this is because the babies have been living in a high sugar environment. The baby is bigger than it should be at that gestational age. So for example, at 28 weeks, it's bigger than we would expect. So there's an increased risk of premature birth. The baby's at risk of having low sugar levels at birth. This is generally because your baby's been living in a high sugar environment. That high sugar level in your body has been traveling through the placenta to the baby. And as a result of this, the baby is producing more insulin to help regulate its sugar levels. So the baby's really good at doing what it's supposed to and getting rid of the extra sugar. However, when it's born, it's no longer in a high sugar environment. So that means that the baby's at risk of having a low sugar levels because it has too much insulin in its body. So this might mean that the baby needs extra monitoring after birth. Another risk is stillbirth. This is a generally very low risk, and if you're feeling nervous about this, please discuss with your doctor. But what are the risks to the mother of having gestational diabetes? Well, in most cases, after the baby's born, the gestational diabetes will disappear. Having gestational diabetes can also put you at risk of other conditions like preeclampsia, which is when you have very high blood pressure during pregnancy. This can lead to very serious complications if we don't keep your blood pressure well controlled. A significant percentage of women, around 50% of women, are thought to develop diabetes later on if they've had gestational diabetes. Usually after you've delivered your baby, you'll have a diabetes check around 6 to 12 weeks afterwards, and your doctor might want to do an annual test on you if you've had gestational diabetes to make sure everything is healthy. How is gestational diabetes diagnosed? Gestational diabetes is typically screened for from around 22 to 28 weeks. That's because that's when these new pregnancy hormones are coming more into play. There's usually 2 tests that we need to do. The first one is a glucose challenge test, and the second one is a glucose tolerance test. So what does that involve? For a glucose challenge test, normally you're given a shot of glucose. And then around 1 hour later, we will test your body's glucose levels. Your body should be doing its best to lower them down to a normal level. If your blood sugar level is higher than expected, you might need further testing to work out if you have gestational diabetes. Usually we would hope that your blood sugar level has returned to around 7.8 or lower, which is around 140 milligrams per deciliter. If this result is raised, you'll likely need another glucose test called a glucose tolerance test. This is similar to the first test, but it usually involves an even higher level of glucose. Then you normally have your blood sugar test every hour for a couple of hours. A doctor will generally diagnose gestational diabetes if 2 out of 3 readings are high. So generally, the rough range might be like this. Impact of gestational diabetes. And then when you have gestational diabetes, you might feel even more overwhelmed in some cases. It's important to get support from family, friends, workplace, and your healthcare professionals. Some women I've seen with gestational diabetes feel some kind of guilt, particularly when they're first diagnosed. But I want to explain to you that just because you've got gestational diabetes doesn't mean you've done anything wrong. It can also be because your hormones have come into play. So it's important to get the support from the people around you, because we want to help support you, from your healthcare professionals like me to your friends and colleagues. Management of gestational diabetes. For some women, diet and exercise are sufficient for managing their gestational diabetes. For some women, you might go on to need medications like metformin or insulin. We need to work together to get the best control of your gestational diabetes so we have the best outcome for you and your baby. My top tip is to be very honest with your doctor, because you need to give us all the readings and the facts to make sure we get the best management for you. With gestational diabetes, it might be a case of monitoring sugar levels. The doctor will advise you how many times a day to do it, but generally it's post meals and a fasting one in the morning. Rough guidelines are here, but your doctor will advise you in your specific case. Remember, these are rough requirements and not every reading was going to be 100% perfect, but we generally look at the pattern over time. Are you having low sugar levels in the morning or high sugar levels after meals? Then we can modify your diet and your medications to make sure it fits with you best. Ways you might have your glucose monitored is by doing finger prick tests or having a continuous glucose monitor. Discuss both options with your doctor and decide the best one for yourself. A continuous glucose monitor is tracking your sugar levels throughout the day and usually involves a patch on your arm. How to manage gestational diabetes usually involves diet modification. Eating a healthy, balanced diet is crucial. Make sure you pair carbohydrates like pasta or bread with good levels of protein and fat. This is to stabilize glucose releases. So you might follow your meals by doing a walk for around 10 minutes or half an hour around your block, and this is again to help with the glucose spikes. You might also need more monitoring of the baby. The baby might need more scans to monitor its growth and development. My top tips for managing gestational diabetes is communicating with family, friends, your partner to explain that you're going to have dietary changes. So if you're cooking meals with someone or your family, that they know what to help you with. So for example, if your work colleagues are continuously offering you chocolate or cake, you might want to explain to them you have gestational diabetes. Or with your partner, you might go through meals that you can cook together to help keep your diabetes under good control. My second tip is to stay within range around 80% of the time. Again, no one will be able to be perfect, so setting that expectation on yourself can be quite pressurizing. Number 3 is everyone's body is a little bit different and reacts differently to different foods. So there might be some foods which are okay for you and not for someone else. So keep an eye on your unique patterns and what is causing your sugar spikes. We are not carbon copies of each other, and that's why we need to have an individual response. And my fourth top tip is when you make a meal, so for example, pasta with vegetables and protein like chicken, you might want to start by eating the chicken and the vegetables first and then the carb. And this is again to make sure you have a mixed plate so you don't get full from just the carbs. So you manage to get the benefits of all the food groups together. 2 more tips is try not to have your heavy meal and go straight to bed. Make sure you walk or do some movement to help keep your blood sugar in check in the morning. So there's no point eating a big meal and going straight to bed. That sugar level will be high in your bloodstream all night. Make sure you prioritize your sleep, as this will help you maintain your diet and make sure your glucose is well regulated. Can you breastfeed with gestational diabetes? After you give birth, you can go to breastfeeding as soon as possible, and your midwife will advise you. This will help keep your baby's glucose regulated. There is no reason you cannot breastfeed if you've had gestational diabetes unless a doctor advises you not to. In fact, breast milk has lots of things which will support your baby and help with the bond between you and the baby. Women with gestational diabetes can have more birth-related complications, such as the baby getting too big, macrosomia. This could lead to potential complications when you deliver your baby, and in some cases you might need a C-section to protect the mother's health. Not every woman with gestational diabetes will need a C-section. It will depend on lots of factors like your health, the baby's health. With the right management, you might be able to have a vaginal birth as well, so that's something you can discuss with your doctor. There's lots of different factors at play, like your health, for example. If you're healthy and you don't have any risk factors and you don't have preeclampsia, your doctor might think it's safe. Or it can also depend on the baby's health. Like, for example, if the baby's not growing well or it's getting too big, then your doctor might advise you in your circumstances a C-section is best. Gestational diabetes and autism. Current research suggests that autism might have a genetic component. I just want to start by saying this is a complicated area, and with autism there thought to be lots of different factors involved, one of which might be genetics. In this study done on rats, just to be very clear, it's not on humans, it's on rats. The evidence suggested that gestational diabetes may affect autism-related behaviour, particularly repetitive behaviour, and gestational diabetes could impact gene expression, so the genetics. However, just to be very, very clear, more research is needed and there's lots of factors at play, not just gestational diabetes. So just to summarise, gestational diabetes is very common. With the right management, we aim to reduce the risk for you and your baby. And if you're worried, you need to speak to a doctor. We're here to support you and guide you through this process. Thanks for watching The Travelling Doc.